So my name is Darlene DeLancey. I'm honored and I'm humbled to be the Medical Center Director at the Stratton VA Medical Center in Albany, just a short stint up the north way. Actually it's down the north way, right? Okay. So first of all, I want to say to you, Senator, I should take my mask off, I apologize. I'm so used to it at the Medical Center. I appreciate everything that Senator Gillibrand has done and is one of the largest sponsors of this bill, and other representatives that have done what they've done for our veterans to ensure the care that they need during this time. You know, the PACT Act is a historic law, and Senator Gillibrand will talk about that, but it's a historic law that provides the avenue for those VA veterans that have earned the honor for us to serve them. It ensures generations of veterans and their spouses and their significant others to get the care they need and to get the benefits they deserve. So it's important to note that this new law not only can increase health care benefits for impacted veterans who already receive care, but it will bring new veterans into our system. The VA wants to serve our veterans. We want to give them the provided care, and we give quality care to all of our veterans. We have screened over 9,000 veterans in this short period of time, and we're prepared to keep on screening, and we're prepared to give them the health care that they deserve. So I'm going to turn it over to Senator Gillibrand.
Thank you so much, Darlene. Thank you. Well, I'm very grateful, Darlene, for your leadership and your advocacy. You do an incredible job for the Stratton VA Medical Center, and thank you for all you've done for veterans in this community. I want to recognize our mayor. Thank you, Mayor, for being here. It's an honor and a privilege. Appreciate all your advocacy for everyone in Glens Falls. I also want to recognize some of our other dignitaries that are here. Richard Lubriel, the Associate Director of the Albany Stratton VA Medical Center. Diana Palmer, Glens Falls Common Council Member. Robert Landry, Glens Falls Common Council Member. Peter McDevitt, Glens Falls Ward 2 Supervisor. Ben Driscoll, Glens Falls Ward 5 Supervisor. And Claudia Bramer, Glens Falls Ward 3 Supervisor. And all of the other elected officials, veterans, healthcare providers, and VA leadership that are here with us to discuss the expanded VA benefits and eligibility provided through the PACT Act. I've been fighting for this legislation for a long time, and the legislation is really simple. If service members or veterans served in places where they were exposed to toxic substances like those emitted from burn pits, they are covered by the VA and they have their full health care benefits. During the Vietnam War, millions of service members were potentially exposed to herbicide Agent Orange, which has been linked to a number of illnesses. While some have received VA benefits, many others have had their claims still denied, which is one of the reasons why one of the first bills I filed when I became senator was the Blue Water Navy Vets bill, which we passed just a few years ago. More recently, during the Gulf War and the wars in Iraq and Afghanistan, millions of service members were exposed to toxic burn pits. And now many are suffering from permanent injuries and illnesses. Illnesses like chronic bronchitis, sarcoidosis, lung cancer, and other types of skin cancers and other diseases. I've heard from veterans, service members, their families, who have been raising the alarm about these toxic substances and the horrible diseases that they cause. So, with advocates and with our service members and veterans, we wrote a bill, the Presumptive Benefits for Warfighters Exposed to Burn Pits and Other Toxins Act. That bill became the centerpiece of the PACT Act. Now, because we passed that bill into law and it was signed by President Biden, millions of veterans who were exposed to these toxins can receive the health care that they've already earned and deserve. As of mid-February, the VA received over 300,000 PACT Act claims and had approved almost 60,000 of them. In addition, I'm joining a letter this week to the Secretary of Veterans Affairs calling for the VA to improve data collection so we can understand how the PACT Act is succeeding and where additional support is needed. That basically means outreach to our service members and veterans who may be experiencing symptoms or other diseases that need to get care immediately. We also need to make sure that veterans in the capital region who are suffering from toxic exposure receive the care they need. Here at the Glens Falls VA Clinic, you can receive primary care related to over 30 illnesses associated with exposure to toxins, including 24 of the newly covered injuries and diseases that the PACT Act now covers. You could also get a referral to the Albany VA hospital or specialists for dermatology, cardiology, psychiatry, and more. You can sign up for the benefits right online if you go to va.gov/PACT, P-A-C-T, to submit your claims. I also want to stress that the PACT Act expanded eligibility for toxic exposure claims. So even if you were previously denied coverage, you should consider submitting a supplemental claim. If you have any questions about the PACT Act and want a specialist at the VA, you can call 1-800-MY-VA-411 at any time. You can also call my office for help submitting a claim. And if you have an active claim, we have the forms you need to fill out here. I look forward to working with the Glens Falls VA and all of you to spread the word as widely as possible. By raising more awareness about these benefits, we can make sure that no more veterans exposed to toxic substances get left behind. I'd now like to bring up our mayor, Mayor Bill Collins.
Thank you, Senator Gillibrand. Thanks so much for welcome back to Glens Falls. We couldn't be more proud. We all know that every veteran deserves the best our country has to offer in healthcare, unfettered healthcare. Our country has an obligation to care for our veterans and those who've given their time and their sacrifices to ensure our freedom. The Gulf War may have taken place 30 years ago, and 9/11 is now remembered over the last 20 plus years, but the analysis of both events have shown clear connection of various chronic conditions as it stands and as it relates to military environmental exposure. The significant expansion of benefits of and services for those exposed to toxic chemicals, those veterans, and creating the creation of a 1-year open enrollment period. That means more veterans can enroll in the VA healthcare without having to demonstrate a service-connected disability. This is a great opportunity for all those that have served. Thank you all so very much.
Thank you. Do you guys have any questions on topic?